All right, well, I have 2 o'clock on my clock. So let's go ahead and get started so that we are timely and keeping you all updated today because we have a pretty packed agenda, and so we don't want to run over time. Start with housekeeping. As usual, all lines will be in listen-only mode, but you can mute and unmute yourself, so be conscious about that. And then if you have a question for the presenters, please make sure to type it in and choose the option in the chat where you can send to all panelists and attendees. This way everybody can read the great questions that we have. If you have a question that's more technical or just for AMCHP staff, then of course just send it to the panelists. And also if you have any other technical difficulties, you can always contact Jess Cohen, jcohen@amchip.org. So I'm going to do a very quick overview of our agenda for today. Give you a very quick legislative update. We'll welcome folks from CDC NCBDD, the National Center on Birth Defects and Developmental Disorders, for a quick COVID update, followed by an MCHB update from Dr. Warren. Then we'll have a great presentation from both CMS and the state of Alaska about how they're utilizing Medicaid waivers during COVID, followed by Dr. Wanda Barfield from CDC Division of Reproductive Health about their newly launched Hear Her Campaign. And we'll follow up with some more information about the AMCHP Telehealth project. So I'll start real quickly. Legislative update on COVID relief. I was working through, putting together the slides today and realized, wow, this is the slide I used last time from July 21st, and unfortunately it's still applicable today. The talks between the White House, the Senate, and the House have not been making a lot of progress. Conflicting information coming out. Congress is on a break. So we won't be seeing any new advancement on the next COVID relief package, which is really unfortunate because we know that there are certain provisions that were expiring or certain improvements that we wanted to make moving forward, certain sectors that really need some extra assistance right now. So we'll keep pushing and advocating for the programs that we have been highlighting for Congress that really need attention right now. But in the meantime, I don't expect to see legislative action probably between now and our next call, but I hope I'm wrong on that. On the appropriations side, the House Labor, Health and Human Services Appropriations Bill passed the House with some great increases for MCH, which we are proud to report. So in the end, the Title V block grant actually ended up with a $30.5 million increase. Originally, we'd reported about $712.7 million, but now that was actually added upon during the amendments process when the bill was considered on the floor. So right now, the block grant would stand at $718.2 million. Again, this is just the House proposal. There still will have to be negotiations with the Senate, and most likely there will be some sort of CR. In fact, just this morning I was reading that a CR could go as long as the end of the year or maybe even until mid to late January. So most likely we will be seeing some sort of continuing resolution, but in the meantime, this is where we are in the House. Also of note, there was a $10 million increase for the CDC Safe Motherhood line, which all is for support to maternal mortality review committees. There was also a $2 million increase proposed for the National Center on Birth Defects and Developmental Disabilities, and then also just a reminder, there was also emergency spending for COVID that was included in that bill as well. But again, it's not signed into law yet. So for more details though on the proposals, there is a link there and will also be in the slides that you receive after the call. As I mentioned though, the Senate's really paused on their appropriations work. And so a CR until after the election or even later is the most likely scenario. Oops. Okay. So with that, I'm going to turn it over to Wendy Rubin with NCB DDD.
Hi, everyone. It's nice to see you all in virtual life. I have a few updates from the response that hopefully will be interesting. So some web updates. The Maternal Child Health Unit wanted to let you know that updated guidance for healthcare providers on the evaluation and care of neonates went live on August 3rd. So just about 10 days old. There's some new materials for neonatal care. Some materials that are coming up soon. It sounds like one of them, they said, like, we expect it to be up by the call, and it's not yet, so it must be an any minute now kind of activity. But there is updated guidance for healthcare providers on care of children with COVID-19 and during the pandemic, should be live at any point. It will still be the same webpage. If you've been going to it frequently, you can keep your bookmark, but it will have some new updates there. And then also coming soon is some new parent and caregiver content about children, and some new content for people who are pregnant or are breastfeeding. Both should be live in a matter of days. So in terms of resources, that's what's coming up. Some items we just wanted to flag your attention to. And last week, MMWR came out with two publications, and I'm sorry, let me pull them up so I can read exactly what they are, but both are related to children. So the first was COVID-19 associated multisystem inflammatory syndrome in children, and it looked at data from March through July. It is just a good summary if you're in the clinical, primarily clinical audience that would be interested, but that is new. It looks at 565 patients. The other one that came out last week is hospitalization rates and characteristics of children aged 18 years and younger hospitalized with laboratory confirmed COVID-19. So it's a nice succinct title, but it looked at children from March through July. And I think this might be particularly interesting for you all because it does do a breakdown of underlying conditions in these children. And a few that I just noted down were prematurity, neurological disease, immunocompromised, blood disorders, sickle cell disease, congenital heart disease. So it had a nice breakdown looking at what are the characteristics of those children. And then last and not least to me, because she's my new boss, but just wanted to flag for you that Dr. Karen Remley, who is our new Center Director for the National Center on Birth Defects and Developmental Disabilities, starts Monday. And we are hoping to introduce her to all of you guys soon. And that is all I have, unless anyone has questions. Wonderful. Well, then I will pass it off and note that Dr. Barfield also could probably answer many questions you might have about COVID. Thanks, Amy.
Thank you, Wendy, for joining us. And I hope you'll stay on the line. And if folks have questions for Wendy or any of our panelists today, please feel free to type that in the chat, and remember to select all panelists and attendees. Next, we will turn it over to Dr. Warren for some updates from MCHB. Dr. Warren.
Hello, happy Thursday to you all. Appreciate the opportunity, as always, to be able to join you and talk with you. And I want to give a little bit of a different approach today. We're going to start out with a celebration. So if we go to the next slide, it's a big day for us tomorrow. So August 14th of 2020 will mark the 85th anniversary of the signing of the Social Security Act, which you all know includes Title V. And so we originally had been earlier in the year planning to do an in-person celebratory event. Some of you may have been involved with the 75th anniversary celebration, which was a really big deal. And then COVID happened. And so we're not doing anything in person, but we will be sending out a communications blast to all of our stakeholders tomorrow. Other partners and stakeholders are going to be doing some social media celebrations as well. So just wanted to pause. It's always good to think about where we've come from and the accomplishments that have been made. And I think particularly when we think about Title V, really recognizing the impact that Title V and the block grant in particular have had for mothers, children, and families in this country. And so if we can go to the next slide, there are a lot of different data points on this slide. I will call your attention to a couple things. One, the bars down in the lower left show us the reach of Title V. So in fiscal year 18, and this is from data that you all share through your block grant applications and reports, so thank you. In fiscal year 18, the block grant reached 91% of pregnant women, 99% of infants, and 55% of all children, or 54%, I'm sorry, including children with special health care needs. So when we say Title V is really the public health system for mothers, children, and families, it really is the public health system for mothers, children, and families in this country when you look at the reach. The other thing that's important to note is that the amount of money that states get through their federal funds in FY18 was about $530 million. But when you look at the match and maintenance of effort and program income, all those things that come in, suddenly you look at a much, much larger reach in terms of about 6.5 billion with a B, in FY18. So really a tremendous reach for this program. And we so appreciate the work that our state Title V and SHIN directors and family leaders do to reach mothers, children, and families every day. So just wanted to celebrate that really quickly and give a shout out and say thank you to all of you. We will have some social media around this tomorrow as well. And so if you have the opportunity to amplify that, please do. And speaking of social media, as you all know, for the last month and a half or so, we've been doing Well Child Wednesdays. That campaign runs through next Wednesday. So if you have not yet done so, please take that opportunity to help amplify that message on HRSA social media. It's Facebook, Twitter, and Instagram. But really, this is responsive to data that was initially shared by our colleagues at CDC showing declines in pediatric immunizations year on year in light of the COVID-19 pandemic. And so a lot of interest in this topic. And because of all that interest, we actually extended the campaign for a few more weeks in August. And actually, there's work going on at the departmental level in conjunction with National Immunization Awareness Month, which give us some additional opportunities to share this message. On the next slide, you just see a map of the reach. We're at up to 42 states that have shared or retweeted the messages. So you'll see if you're one of those states in light blue, you still have time next week. Next Wednesday is the last week where we'll be doing this. So take an opportunity to help share. And then on the next slide, just to show across HRSA, how some of our partners are helping with this work. So health centers, community health centers, federally qualified health centers are helping to share this message. So a big shout out in particular to Utah, Kentucky, and Colorado, where we've had some really high volume shares in the last few weeks. So hope you take a moment tomorrow to celebrate the 85th anniversary of Title V. Thank you, all of you, for all the work that you do to help keep that legacy going every day. And I'm going to transition now. We've got a couple of folks I think that I am introducing. So Jackie Glaze is here. We're thrilled that she's joining us. She's the Deputy Director of Medicaid and Child Operations and CHIP Operations at CMCS. And she's going to talk about COVID-19 support to states. And then Becky Morrissey, speaking of Title V, is the Title V Director for Alaska, the Department of Health and Social Services, and she's going to talk about their experience with a COVID-19 waiver on telehealth and midwives. So I'll turn it over to Jackie.
Thank you, Michael, and really appreciate the opportunity to speak with all of you today. I would like to just tell you all we have really appreciated the partnership with HRSA and the rest of you. So moving on to the next slide. So just wanted to briefly let you know that we will be talking a lot about how we supported states with the COVID-19, the types of resources, tools, and the types of waivers and other flexibilities that we were able to support states and territories through COVID-19. And then also talk a little bit about some of the next steps and what we're doing to work ahead as we prepare for other types of public health emergencies and natural disasters. And then, of course, any kind of questions that you may have at the end. So we can move on to the next slide. So to begin with, I just wanted to provide just a little bit of context about what public health emergency is and how it relates to the 1135 Waiver Authority. You may all have this information, but thought I'd just provide just a little bit of context. So as you're aware, the President did declare an emergency through the Stafford Act on March 25th. And prior to that, on January the 31st, the Secretary declared a public health emergency. So it is required that we have both of those declarations before the Secretary can waive certain Medicare, Medicaid, and CHIP flexibilities through the 1135 Waiver Authority. And so the 1135 Waiver Authority gives us the ability to waive certain areas where it does provide more access to care services, but it does not apply any kinds of conditions of payment. There are other types of flexibilities that we can use for that. So prior to this public health emergency back in 2018, we developed a disaster relief toolkit, and that was in response to 2017 disasters such as the hurricanes. I believe we had an earthquake and wildfires. And so we worked with a contractor and developed a very extensive inventory that outlined all the various types of flexibilities that could be available, and the authorities and action states and territories would need to accomplish those. And so that was something that we used to help us prepare for this pandemic, even though it was a little difficult to even, foresee what we would have to deal with. So we took that toolkit and we began to develop additional documents. So one of the documents that was very instrumental with helping the states and territories was the Section 1135 Waiver Checklist. And that checklist was... Yes.
Sorry, I'm just going to interrupt you for a second. We're having some difficulty. You're breaking up a little bit, and I don't know if you have another option for.
Can you hear me any better now? I've moved up a little closer. Is that better?
Yes, thank you.
I'm sorry. I'm sorry about that. So
yeah,
do I need to repeat anything, or just? Okay. Do I need to repeat anything, or just keep moving?
I think you can keep moving along.
Okay. I apologize for the audio being poor. So I wanted to just talk briefly about the toolkits and checklists that we've developed. And the 1135 Waiver Checklist is a document that we developed in early March once we learned about the public health emergency. And it outlined a number of flexibilities that states and territories could use. And it was outlined to where they could just check a box, tell us what they need, and then we were able to return those back very quickly with approvals. So we received 1135 requests from all states and 3 of the territories. So we received quite a few of those. We also made updates to the HCBS template, and it was able to give states flexibility through an Appendix K, which allowed them to be able to make a number of changes there. Is everyone still able to hear me?
Yeah, it kind of comes in and out. So I guess as much as you could be closer to your computer, sorry.
I'm as close as I can get, so I truly apologize. So, and then following that, there's also the 1115 Waiver Authority that's available, and that's an authority that we explore when other types of authorities cannot be accomplished. So we can move on to the next slide, please. Here, I just wanted to give you a quick snapshot of the number of approvals that we have submitted to date. As you can see, we have been extremely busy and have been able to approve a lot of flexibilities. Just to give you an example, the 1135 waiver flexibilities that we approved, the 109, that does include multiple requests. So some states would submit as many as 50, if not more, requests within one submittal. So this is an actual one request that was approved with multiple types of requests. So I'm not going to go through all of those, but I just wanted to give you just something so that you can see the amounts of requests that we received and have approved thus far. So we can move on to the next. Here is just an example of some of the 1135 waiver flexibilities that states have utilized. I will walk through them fairly quickly. The temporary relaxation of the provider flexibilities. It gives states and territories the option to enroll providers that have certification or have licensure through other states for Medicare, and it allows them to temporarily, provisionally enroll their providers during the emergency period. So they can always enroll them permanently once the emergency is, but this just gives individuals access to more services so that we have more providers available, and then it also allows to give the providers their payments very quickly. In addition to that, it allows us to give states flexibility to extend the fair hearings and appeal timelines so individuals can have continuity of care during public health emergency. The states can also suspend the Medicaid fee-for-service prior authorizations as long as they are outlined in their state plan, so that they can make modifications so that individuals, again, will continue to have access to needed services. And then in addition, states can also require that providers extend pre-authorizations that are currently in place prior to the public health emergency. We can move on to the next slide. The next slide deals with the Medicaid disaster spot, and it also is a new template that we developed with this public health emergency, and it allows the states and territories to combine all of their requests in one state plan. So it does provide a lot of flexibility with cost sharing, with co-payments and premiums. It allows to increase provider reimbursement and retention of providers so that they can provide enhanced payments. It does provide continuous eligibility for children up to 12 months. And in addition to that, it is also expands coverage to those uninsured individuals affected by COVID-19. So there are a number of flexibilities, and I will, as we talk further, I can refer you to our website that gives you more detailed information about this. So we can move on to the next slide, please. I wanted to talk just a little bit about the CHIP disaster spas. I'm sure many of you are familiar with these. And the CHIP disaster spa gives states the ability to include these provisions in their CHIP state plans prior to the emergency so that they can begin implementing those immediately as soon as they notify CMS that they need to begin moving through with those. If they don't have those in their state plan before the emergency, they can do it during emergency, and we can make it retroactive with the first day of the public health emergency. But there are many provisions here that states have the flexibility to implement, and that does allow enrollees to receive services beyond their certification period so that there will not be a delay with their coverage. They can also extend the time for which they submit verification at the time of the renewal. So it just helps the states continue with their eligibility for the individuals and their coverage, and then after the fact they can go back and do the renewals and request the verification. It also, again, helps continue coverage by delaying any kind of changes in circumstances that could affect an individual's eligibility, and also delays or suspension of copays and deductibles and premiums. So individuals do not have to be concerned with that during the time of the emergency. We can move on to the next slide. So I just wanted to just briefly share with you the guidance that we have provided thus far. We are issuing guidance on a weekly basis. We've done 4 sets of frequently asked questions, which are on our website, and it does cover all of the different policies and clarification that we have been able to grant. We have also issued 2 sets of FAQs that fall within legislative actions with the FFCRA and CARES Act. And we've also are currently holding weekly calls with the states. We began doing that in March, and we were doing that twice a week, but now we're just holding those on Tuesday. We do bring in guest speakers. We do a lot of policy discussion. We take questions from the states and territories and others, and really try to build on any kind of questions or needs that they might have. Our resources are all located on Medicaid.gov. You can find that information under the federal resources to states, and then clicking on the disaster response toolkit, and that outlines all of the approvals that we've been able to approve thus far, all of the guidance, all of our checklist, all of our tools. So it's a very comprehensive set of information. So moving to the next slide. Just looking ahead, some of the work that we're continuing to do is we're updating all of our tools so that they will be evergreen, and they'll be ready to accomplish any kind of public health emergencies that we may encounter in the future. And then we are also providing guidance. We're working on a document which is a state health official letter, and it will provide strategies to help states move back to the regular operations. So some of the flexibilities can continue on a permanent basis, within the federal guidelines. So we provide a lot of comprehensive information to help states. So that probably won't be released till, I would say probably later this month or maybe early September, but that will be a document that would be very, very helpful. So I'm sorry about the audio, and I hope that you were able to hear my presentation. So that really concludes my remarks at this time. Thank you so much.
Great, thank you so much, Jackie, and thank you for including your contact information if anyone has follow-up questions, and of course I hope you'll be able to stick around for Q&A as well. Now we're going to hear from Becky Morrissey of Alaska. Becky.
Hello, thanks for inviting me to participate today and share our story about what's been going on here in our state. So our Title V agency has been working really closely with our healthcare provider community during the pandemic response. We've been doing that mainly through two venues. One is through our statewide perinatal quality collaborative that our Title V program administers, coordinates, and also through our perinatal COVID-19 project echo sessions that we've been hosting. We were hosting those on a weekly basis during the first few months of the response, and now we've transitioned to hosting those monthly. But nurse midwives and direct entry midwives have been an important part of that process and have participate on both of those projects. And like mentioned before, so Alaska Medicaid is now allowing direct entry midwives to provide some services via telehealth during the public health emergency. And this has been really important for us here because Alaska has the highest proportion of community births. When we say community births, we're talking about planned home or freestanding birth center births in the US. We have our proportion of community births is about 4 times higher here than it is compared to the rest of the US. It's about a little over 7% of our births each year occur outside of the hospital versus about 1.6 nationally. And the midwife is an important part of our provider community because they attend about a little over 30% of all of the births in our state are attended by midwives. And one of the professional organizations that we've been working with in our collaborative is the Midwives Association of Alaska, and they're the professional organization representing direct entry midwives. And I've communicated with them about this as well, and they've noted that there was an impact for them. It allowed them to do distance-based appointments, particularly in the spring, in those first few months of the pandemic. They've now, our state opened up essentially at the end of May, and that's allowed more in-person healthcare visits, so they're transitioning back to that. But, in communities like Fairbanks or Juneau, where the midwifery centers, they're serving patients who live quite a long distance away from those cities. And in particular, when travel has been challenging, restricted, or even non-existent at times for us, one of the major airlines serving our rural communities shut down overnight during the spring, and all people were stranded. There's no flights going in and out of those communities. So having telehealth as an option has been really important for those women that choose to have an out-of-hospital birth or want their care from a midwife, or in this case, a direct entry midwife. Our state capital of Juneau, to get to that community, you need to either fly there or you need to take a boat there. So it's really allowed for patients in those rural communities to get some prenatal care services education that they wouldn't have been able to receive at home from a midwife. The other thing I wanted to mention in terms of Medicaid changes related to telehealth, that's also been a big impact to our MCH community, is in regards to children and youth with special healthcare needs. So we have very few pediatric specialists in our state. They are entirely in Anchorage. So as a part of our gap filling work with Title V, our state has sponsored some pediatric specialty clinics as a gap filling service. So most of our providers well, actually all of them, I believe, are out of state, based at universities in the lower 48. So when the pandemic started, Alaska Medicaid did some emergency regulation changes and made other changes that really relaxed things and allowed billing for telehealth to open up. And that's been huge for us, particularly, with us having physicians in the lower 48, when COVID-19 and all those travel restrictions, having those clinics in person for us in Alaska is challenging, if really much impossible. So we're now able to bill for telehealth clinics, and in June we started doing those in our Title V program, even with the providers being out of state. So this has been a real success for us to keep services going in Alaska, particularly while people can't travel. So it's given us an opportunity to continue to serve families, and we're also and we're working with our provider community on this as well. Our clinics for autism neurodevelopmental screening, both the one we do and then in the tribal health and the private sector, have all transitioned to telehealth, and that Medicaid impact was felt there as well, not just with our state-sponsored clinics. So it's allowing us some flexibility to, instead of traveling a provider to X community once a year, having telehealth, we can serve on a statewide level and really triage those referrals and who should be seen first. So it's been really, really helpful for us in Alaska. So those are the two probably big things that I wanted to share. Thank you.
Great, thank you so much. Those are great examples. And I hope we'll have plenty of opportunity for more state sharing in the future. And I think the example you gave is also really relevant to some of the work we're doing around the CARES funded telehealth project that we're going to hear about a little more later. But first, we'd like to invite Dr. Barfield to tell us about the new Hear Her campaign.
Hello, everyone. How are you? It is great to be here to talk to you about the Hear Her campaign. And I just want to make sure that everyone can hear me okay.
We can.
Perfect. So I'm Dr. Wanda Barfield. I'm the director of CDC's Division of Reproductive Health, and I just wanted to share with you some exciting new information on the Hear Her campaign, and it just was recently released. So I just want to, first of all, recognize the work that each of you are doing in states to promote maternal health. And we're really hoping that this campaign will help to amplify and support the work that you're already doing. And we know that this is just one of many strategies to prevent maternal mortality across the country. So the goal of the campaign, and you can go to the next slide, please, is to raise awareness of the potentially life-threatening warning signs during and after pregnancy, as well as to improve communication between patients and their healthcare providers. And so the objectives are to increase the awareness of serious pregnancy-related complications and their warning signs, and then to empower women to speak and raise concerns. And then we also want to encourage women's support systems to engage in important conversations with them. Next slide, please. So our primary target audience is pregnant women, postpartum women, and their support network. So this includes family and friends. But our secondary audience is really healthcare providers. Next slide. So I want to just share with you this 3-minute video that features the 5 women who shared their story for this campaign. And it may be a little choppy because of the, having to go through the system, but I'm going to mute my phone so that you can hear it.
Being a mother is amazing, and we have this story together. we both survived. And not everyone who faces what I faced gets to say that.
I had constant chest pains. It felt like someone was stabbing at my chest. It felt like I couldn't breathe for about a good 3 to 4 minutes, and it was painful.
I had heard of preeclampsia before, but I had never, experienced it due to the fact that my first pregnancy was so normal. So once I started having the symptoms, it was very, very scary.
I knew with this pregnancy something didn't feel right.
If you know in your gut that something is wrong, something is wrong.
I told my family members, and they were like, it's just pregnancy related. Everyone goes through it. I told my spouse what was going on. He was like, you're exaggerating.
And then when I would voice my concerns, sometimes it would be, oh, you're pregnant, your feet are supposed to swell, or oh, you're fine, you're pregnant, like it's fine. But I didn't feel fine.
I didn't have what I needed, the tools. I didn't know who to talk to or how to talk or how to speak up for myself. I was scared. I was scared a lot of the time because I just felt like no one heard me.
No one should have to feel that way at all.
I felt like I don't think that this is normal. I don't think that I should be feeling like this. So I went to a different hospital and they found an 11-centimeter abscess on my uterus. They'd never seen this before, and they said that had I not come in, it could have easily been a there's nothing we could do situation. So even if those around you aren't listening, or they're trying to pacify what you're feeling and telling you this is just normal, trust your gut and know that it's not normal if you don't feel it's normal. And tests may come out, to say that it's perfectly fine, but you'd rather err on the safe side and know that you're okay.
It's extremely important to hear women because you don't know what they're feeling, but they do.
My advice to a woman is, yourself, your body. If it's nothing, then let the doctor tell you that it's nothing, because you'd rather be safe and it be nothing than have not spoken to anybody and it be something very serious and something that is preventable.
I just really want women and their support systems to advocate hard. It could mean your life. It could mean your child's life. There's no little questions when it comes to your health care.
I want to share my story to help other women speak up and be heard. Hear her.
So these are clips from the 5 women who are featured on our website: Alora, Valencia, Kylie, Sanari, and Lindsay. And more of the details of their stories are on the CDC website. Can you go to the next slide, please? So this is a screenshot of the campaign website, which you can access by going to www.cdc.gov/Hear Her, and the website has been translated into Spanish also. So on the site we have information about pregnancy-related deaths in the United States, personal stories from these women who have experienced pregnancy-related complications and captured it on video, and then information about urgent maternal warning signs that we received from the Council on Patient Safety in Women's Health Care. And there are also resources for pregnant and postpartum women, for their support systems, for healthcare providers to facilitate the conversations. And then there's also social media posts and graphics that you can share through your own channels. If you go to the next slide, you can also see that we have launched a Hear Her Facebook page, which will be the hub where we can target campaign messages and resources directly to pregnant women and their support networks. And we'll create some new and engaging content throughout the life of the campaign. So this is one resource that we hope that you will share with your networks and communities. And we're also interested in sharing resources from AMCHP and others that may be relevant to our target audience through this page. And in this next slide, you can see that there are a number of ways that you can get involved, whether it's connecting with us through social media. If you know someone who's experienced a serious pregnancy-related complication and would be interested in sharing their story, please let us know. We're particularly interested in making sure that participation as well as the complications that we're featuring are diverse, and that we can provide as much representation as possible in future materials. And we're interested in the perspective of the partners, family, and healthcare providers for future iterations. And if there is a partner that you are working with who would be interested in the material, please feel free to share the materials with them and to connect with them or with our team for more information and resources. Also, if you have some relevant content that we can link to, please send that information our way. In the next slide, I'd like to just invite you to post a visual of the campaign with a web link to your website where it makes sense. So you can share the announcement internally or externally to relevant stakeholders, and we'd be happy to share language with you for this. And if you'd like to include campaign messaging or slides in any of the meetings or webinars, we'd be happy to provide you with something as well. And we'd also appreciate if you'd let us know how you've promoted the information, or whether there are any available metrics to provide. This will help us to keep track of the activity. And the best way to get connected to someone with the campaign is to reach out to hearher@cdc.gov. So in the next slide, let's talk about what's next. So we continue to develop content, and we're continuing to disseminate work through a strategic and phased approach. And we want to recruit additional participants to tell their stories of pregnancy-related complications. And it really is important that we identify a diverse group from various race and ethnicities, additional warning signs and health complications, and we also want perspectives from providers and the women's support systems as well. We do plan to do some messaging for American Indian and Alaska Native audiences so that we can better tailor the materials for their community. So we'll begin on focusing on additional tools and materials as well for healthcare providers. And then the next slide, we just want to acknowledge the support that we've received through a partnership with the CDC Foundation, as well as funding from Merck through its Merck for Mothers program. And we really appreciate all the partnership from many of you, and we're really looking forward to working together as the campaign evolves. And I'm happy to answer any questions that you have, or you can always reach out to either me or someone on my team by emailing us at hearher@cdc.gov. Thank you, and if there's any questions, I'm happy to answer.
Thank you so much, Dr. Barfield. What a great and powerful video. Thanks for sharing it with us. I know AMCHP has already and will continue to share it as well, and hopefully our listeners today will take you up on that offer. So next I'm going to turn it over to my AMCHP colleague, Sabra, who's going to talk a little bit about our CARES Act funded MCH Telehealth Capacity Project. Sabra.
Hi, thanks so much, Amy. Can you guys hear me?
Yes.
Okay, great. So thank you all very much for this opportunity to take a couple minutes to speak with you. We are very pleased to share our still evolving project that will support developing MCH telehealth capacity within public health systems. This is a project funded by HRSA, so thank you very much to them. And I also want to introduce myself as the project director. I joined AMCHP for this project back towards the end of June. I was previously in Alaska, and Becky, who we heard from earlier, was my boss. So I'm very excited to be presenting with her again. I have a background as a nurse, as well as in the public health field, working in MCH across the scope of work between Title V, newborn screening, as well as I have served as a home visitor. Joining our team is also Brittany Frew, who is our project manager, and Olivia Umaran, who is our health policy fellow. We are pleased to share that we were awarded $4 million from HRSA to support our telehealth work. We will be looking at this in sort of 3 focus areas. So those are Title V and SHIN, MCV home visiting, and then newborn screening, so blood spot, CCHD, as well as hearing screening programs. And the next slide. So we have a wonderful and comprehensive group of partners, stakeholders, and experts in the various fields that we will be working with throughout this project. Those include representatives from home visiting and screening communities, as well as Title V and SHIN, policy specialists, including our colleagues at ASTO and NACHO, our lived experience and family experts from Parent to Parent USA, as well as folks from the telehealth community. So I'm sparing you the alphabet soup salad of all of our partners, but we are very excited to work with them. We will have multiple components to this project, of course, and it will continue to evolve as your needs evolve. One is technical assistance in any areas that you are using telehealth or would like to be using telehealth in your states or territories. You may make those requests for technical assistance at any time through the end of April of this project, simply by emailing us at telehealth@amchip.org, and we welcome those requests. The other part that we are doing that is of, I think, particular interest to a lot of people is we are issuing direct awards. We anticipate releasing an RFP on Tuesday, knock on all the wood everywhere, that will announce awards up to $100,000 each to support telehealth building, expansion, innovation, and sustainability for our state and territorial MCH partners. There's a lot of details on who exactly is eligible, but we are very excited to work with a wide range of partners across the focus areas within each state or territory as they are able and as their needs are identified. This project will be incredibly family-centered. We want all of our work to improve the experience of families receiving services from MCH programs. That may mean families having access for the first time, perhaps because they are too far distant to receive services, or improved service access as well. So we're really looking to support projects that will stay focused on that as the end result, so that we really want families to ease their burdens through the use of telehealth in your MCH programs. We're also really looking to focus on equity and access, and use this opportunity as a new technology that many of you are implementing in your programs for the first time, to really take advantage of that and start from a place of how can we ensure that the communities that we may not always provide the best services to start there. How do we use this as an opportunity to expand equity and access to our healthcare services and to health through the provision of telehealth services? We'll be looking for sustainability and innovation, and really working with you all as we go on this journey together. We anticipate it will definitely evolve over time, and even in the short time that we will be working together on this as a response to the pandemic, but really trying to take advantage of that by solidifying the role of telehealth in MCH public health services. So our timeline, thank you. Next week, we will release, these are all very tentative, so please do not hold me to any of this. We will release RFP next week. The following week, we will hold a Q&A webinar that will be recorded. We will, of course, be releasing this RFP to all of our known partners within AMCHP, our members and partners, as well as all of our stakeholder partner organizations will be releasing it through their memberships as well. We will be asking for letters of interest by September 1st. The first cycle of proposals will be due September 15th, and we will announce those September 30th. We'll then have a second cycle, which will allow for those states and territories that may just require more time to put together a proposal because of bureaucratic restraints, as well as we will be offering technical assistance in the actual application process, because we really want to get applications from all the states and territories that have identified needs and innovative solutions to work towards, with a focus on that rather than a focus on a lot of experience in grant writing. So we will be offering assistance to anybody who would like it, and anybody that is not funded through the first cycle will be offered technical assistance to strengthen that application. We do hope to have all awards announced by the end of October, which will give us 6 months to complete all work. It is a very tight timeline, so it's a little bit different, I think, than most of the funding opportunities that we announce, which are around sort of long-term quality improvements, and this is really a response to the pandemic and taking advantage of that opportunity. Next slide, please. So one thing before we get into sharing is, if you are on this call and you are a Title V or SHIN director in your state or territory, and you have not completed the survey that we've sent to you requesting information about your own technical assistance needs around telehealth in your state or territory, please do that today. The deadline is tomorrow. We absolutely need these responses. We're not just looking at this survey as data to be compiled and looked at quantitatively. We plan on reaching out to folks directly based on their responses and offering them that technical assistance, developing learning communities, et cetera, as we find the topics that are that people are expressing the most need in. If you are not the Title V or SHIN director, but you know your Title V or SHIN director and would like to poke them a little bit on that, again, the deadline is tomorrow. If you have lost the email that we sent out and need the link to the survey again, please feel free to email us there at telehealth@amchip.org. My wonderful colleague Brittany is building us a website that will be located at amchiptelehealth.org, which is where we will release the RFP through next week, and we are very excited. And Amy will have to guide us on this, but depending on how much time we have, we want to at the very least ask everybody to share in the chat box, how have your programs used telehealth since the start of the pandemic? There are no right or wrong answers to that question, but we really want to start and evolve this conversation to understand where people are at and where they would like to be and what has worked for some and has posed more challenges for others. So we definitely welcome your comments. Please make sure to put them to all panelists and attendees so that everybody can see and share.
Great. Thank you so much, Sabra, for taking the time to share some more information. And I should have really started off by thanking all of you who participated in our conference last week. We thought it was really successful, especially in the virtual format, and it couldn't have been so without the active participation of our attendees. So thank you, and thanks to the many of you who participated in one of the roundtables that we hosted on this topic then, but we are always looking to learn more. So we do invite you to type now into the chat, as Sabra mentioned, to all attendees, not just the panelists, although we'll share if we get anything. And there actually was a question earlier for Becky about some of the policies and training that Alaska put into place when initially implementing these telehealth changes. Becky, do you have anything to share on that?
In terms of, I guess is the question in terms of this, what we had to do, like in our Title V program policy change, or?
I think so. Jonathan, do you want to elaborate?
That's it, yes.
Oh, sure. Okay. Yeah. So we had to create policies for telehealth forms, get that approved by legal. We worked closely with Medicaid on that. They were really a partner in helping us make it happen. So we received some technical assistance from them. We also sought out some other opportunities through like the resources Western States has, and also through Seattle Children's Hospital, who had some resources on setting up telehealth. And we had to also, working with your IT department was also helpful in getting HIPAA compliant Zoom set up. So they were also an important partner. But yes, we did have to create new section policies related to telehealth and consent form. I hope that answers your question.
It did, thank you.
Thank you. Some folks are typing into, sorry, Jonathan, were you going to ask a follow-up?
No, I was just going to do a quick follow-up. So one of the things that we're learning is that as people are transitioning or looking to transition to telehealth, it's a new area for folks. So in addition to the policy, people may not feel as though they've had the training or the prep, either for them or for the families they're engaging with how to best use whatever service is being offered through telehealth. So can you, I don't want to put you on the spot, but can you speak a little bit about whether or not there was any training that took place for you or families?
That's a good question. No, we didn't have any, we did it rather quickly. You know, we didn't do any, you know, group training or anything like that. It was mostly just looking at resources, having meetings, calls. It was helpful in terms of train. This is maybe not formal training, but working with our tribal health system was really helpful in hearing how they were doing things, because they've been doing, because in Alaska, tribal health's been doing a lot more telehealth, you know, for some time. They're a little bit ahead of, I would say, the private sector in our state. So having their technical assistance was also really helpful. But yeah, I think in retrospect, you know, having more formalized training for us would have been really helpful. I feel like we grabbed the opportunity for as many resources as we could that were available and our subject matter experts. But yeah, I think more training on that is definitely helpful. We did also shift to telehealth in our home visiting program too, which I didn't mention. We're not doing any Medicaid billing there, but there was a learning curve there as well. But it's definitely been a learning experience. It's something we've, you know, in our perinatal quality collaborative, we've discussed in our provider community, the pros and cons, and that really changes based on the type of visit you're talking about. You know, and there's just some things, you know, like ultrasound, you're not going to do via telehealth. So it's, and one thing also I would say too, is that now that we've had this capability and people have had that access, you know, it's going to be hard to go back in some ways, because now that you see the possibilities, you know, I don't imagine us ever wanting to be completely like the way that we were, you know, hopefully becoming some type of hybrid where we have in person, but we also have this flexibility to do more when it's needed. So I'm hoping that, you know, we can work with Medicaid on that and hopefully, you know, keep these options open to us. I would love to see that happen past the pandemic, but we'll see.
Thank you, Becky. Coming through in the chat, and again, some of these I think only went to the panelists. So, and we only have about a minute left. I just want to mention there was a question about challenges, and one of our members from West Virginia mentioned that, you know, the availability of technology supports, limited broadband access, especially in rural areas, are really challenging to reach the full potential of telehealth. And I know those are top of mind as some of the challenges we want to address through our project. So we are really looking forward to learn from those of you who have had success, and also figure out ways that we can help those of you who need some more technical assistance in reaching that. I will note as well from Utah that the SHIN program is using telehealth for all in-person visits that used to be clinic services and home visits, and reporting 90% satisfaction from families. So I'm gonna call on from Utah to send us more information about positive feedback that you're hearing from families, as well as how you're collecting that. I think that would be really interesting for us to know as well. And there might be other states that are looking for ways to assess the satisfaction of the folks who are being served by these services. I see Sabra wanted to chime in.
Yes, I just wanted to share. So we are going to be building a resource library. There are a lot of telehealth resources out there right now, but there aren't as many that are focused on our population, as well as most of them are focused on Medicare, which tends to impact our population less. And so those sorts of resources, tools that people have developed, even if you think it's not that big of a deal or not that great, please share it and give us the opportunity to allow your colleagues in other states and territories to learn from that as well, because we're all embarking on new territory and learning things and learning what didn't work, which is also really, really important to share with folks. And so we're looking forward to building that resource library and developing it over time as everybody's needs evolve.
Great. Well, we are a minute over. I told you we had a packed agenda, so I'm sorry we didn't have more time for Q&A, but all of us are available for follow-up. And if you didn't catch contact information from one of the panelists, you can send that to AMCHP, and we can make sure that that reaches the right person as well. Our next call will be in 2 weeks. Please fill out the survey afterwards so we can continue making sure that we're providing you with the information that you would find most helpful. And I think we are planning already maybe to hear from some other states on their COVID waiver for Medicaid waivers, and as well as a youth perspective on the school reopening issue, which has been a hot topic of many of these calls. So those are still on our radar as well. But if you have other suggestions for things that you want to continue discussing, please let us know as well through the survey. And stay safe and enjoy the rest of your day. Thank you.